It's a pleasure for me to introduce you to the Adolescent Health Focal Area of the Department of Population, Family, and Reproductive Health. I am Bob Blum, and for the last more than 30 years, my work has focused on adolescent health. PFRH has an extraordinary history of research and training in this area. Zelnick and Kantner's work in the 1960s and 70s was some of the earliest research on adolescent girls' sexual and reproductive health. In the 1970s and 80s, Laurie Zaidman did landmark research on school health services and their impact on reducing teen pregnancy. From the mid-1990s to just last year, Freya Sonnenstein led the National Survey of Adolescent Males. And I've had the opportunity to serve as the co-principal investigator for the initial waves of the AdHealth, or National Longitudinal Study of Adolescent Health. But what distinguishes us in this department is not our past, but the future. And we have some of the country's most exciting faculty in this area. Jacinda Dariotis, for example, is exploring brain maturation and adolescent risk-taking. Terry Williams is working with a network of African American churches to address teen pregnancy and reduce sexually transmitted infections and HIV. Kristen Murray has recently completed a qualitative study of adolescents growing up in the slums of Johannesburg, Delhi, Abadan, Shanghai, and Baltimore. And my colleague Caroline Moreau and I have recently launched a 10-country study on the transitions into early adolescence and the factors that affect gender norms, attitudes, and beliefs in those settings. But we don't just do research. Michelle Hinden recently worked with the World Health Organization to help them develop their research priorities. I worked with UNFPA in 2013 on the State of the World report on adolescent pregnancy. And I wrote a companion document on effective programs. Arik Marcel was instrumental in helping the CDC develop their guidelines for adolescent male sexual and reproductive health services. All of us are active teachers in the department. In fact, altogether, there are more faculty in this department who are focused on adolescent health, 10 or more. We teach courses on adolescent health and development, school health, social ecology of adolescent health, international adolescent health, adolescent sexual and reproductive health, adolescent male health, and the list goes on. These are just a few of the offerings. We welcome your exploration of our webpage, and we welcome any questions that you have. Please feel free to contact me.